Today, we are going to look at a BodyViz brain builder about the endocrine system and pancreatic cancer. The primary function of the endocrine system revolves around helping maintain homeostasis in the body. The maintenance of homeostasis involves the integration of numerous organs and systems throughout the body, including the nervous and endocrine systems. When comparing the roles these two systems play, the nervous system provides short-term and very rapid adjustments in order to maintain homeostasis, while the endocrine system produces adjustments that take longer to occur but are maintained for a much longer period of time, often days or more. The endocrine system is composed of ductless glands that release a chemical signaling substance, termed a hormone, into either interstitial fluid, the lymphatic system, or the cardiovascular system. This hormone then diffuses away from its source and exerts its chemical effect at a group of cells or an organ that is either close in proximity to the endocrine gland or distant from it. The traditional endocrine glands include the pancreatic islets, also termed the islets of Langerhans, within the pancreas, the suprarenal or adrenal glands, anterior and posterior pituitary glands, gonadal structures, thyroid gland, and the parathyroid gland. However, recent advancements in our knowledge of hormones has increased, and the view of the endocrine system has changed drastically to include additional organs that are sources of hormones. Let's focus on the anatomy of the pancreas. The pancreas is both an exocrine and endocrine gland. In its exocrine role, the pancreas produces bicarbonate, which aids in the neutralization of stomach acid, and a series of digestive enzymes involved in the digestion of proteins, fats, and nucleic acids. The endocrine portion of the pancreas releases glucagon and insulin, which are two hormones that strive to maintain healthy blood sugar levels. These hormones are synthesized by and released from endocrine cells within the pancreatic islets. The pancreas lies along the posterior wall of the abdomen, passing from right to left. It is divided into 4 segments: the head, neck, body, and tail. Next, let's learn about pancreatic cancer. Pancreatic cancer is rarely detected in its early phases when it would be most curable. This is because pancreatic cancer typically doesn't produce any symptoms until it has metastasized to other organs of the body. Most cancers of the pancreas develop within the exocrine ducts of the pancreas, and therefore are classified as exocrine cancers. Some cancers do begin within the pancreatic islets, and these forms of cancer are classified as pancreatic neuroendocrine tumors. This form of pancreatic cancer presents a significantly greater prognosis for successful treatment than do exocrine cancers. Next, we will look at the symptoms, risks, and treatments for pancreatic cancer, and finally give a patient example. When pancreatic cancer does exhibit symptoms, the tumors are typically quite large, or the cancer has metastasized to other organs. The symptoms can include jaundice, abdominal and/or back pain, nausea and vomiting, weight loss and poor appetite, blood clots, enlargement of the gallbladder or liver, and diabetes. Some of the risk factors contributing to pancreatic cancer include chronic pancreatitis, being overweight, smoking, diabetes, age. Most pancreatic cancer develops in individuals over the age of 45. Sex. Males develop pancreatic cancer at a higher rate than females. Race. African Americans are slightly more likely to develop pancreatic cancer. And family history. Possible treatments for pancreatic cancer include surgery to remove part or the entire pancreas, chemotherapy, radiation therapy, clinical trials to test new treatments, and supportive or palliative care, which focuses on providing pain relief. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age 42, sex female, chief complaints nausea and back pain. You enter the patient's room for an examination and notice your patient has yellowing in the sclera of their eyes, which is an indicator of jaundice. You talk about what has brought your patient in today, and they explain how they have been having a general unwell feeling recently, including a lack of appetite and vomiting. Your patient explains how she figured she may have just caught something and hoped it would pass. However, when she developed back pain and her family also noticed the yellowing of her eyes, she figured maybe she should schedule a visit with her doctor. You review your patient's history and see that she's diabetic and a smoker. You send for some tests and a CT. When the CT scan comes back, you put it into BodyViz 3D imaging software and note a large tumor in the head of the pancreas in the pancreatic islet. You support your patient by explaining treatment options and recommend surgery to remove the tumor in part of your patient's pancreas, while the cancer remains isolated. Your patient agrees and the surgery is performed. Further tests after the surgery show no signs of cancer, and your patient is in remission. This is a classic example of a pancreatic neuroendocrine tumor. Want to see more real 3D anatomy visualizations, like the ones used in this brain builder? Check out BodyViz 3D Dissection Software. Go to our website to schedule a demo today.